Dr. Robert Murphy. He's a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning.
Good morning.
Yesterday we talked about, numbers going up in the state. We're 5-point-something positivity rate. Wisconsin was way up, but I'm looking at this number for Northwest Illinois, 11.9%.
That's just amazingly bad. I don't know what is going on in the northwest part of the state, but they are completely out of control.
What do we do about the restaurants and bars shutting down? I think people they have this COVID, they're exasperated by it and people aren't making any money. So do you see this? I mean, you're going to keep inching up those times when you can stay open to or shutting them down. What do you think is going to happen here?
Yeah, well, I mean, the same issue was brought up in the debate last night. You want to just keep these things open so that they can sell liquor and food and have the people mingle more and increase the number of infections. And increasing the number of infections means killing more people. Is it worth the life? Life's lost. People will die. The fastest growing group is 25 to 44 years of age. Not the most deaths, but the fastest growing age group. Those people, they go home, they meet their parents, they meet the other people that they work with that are older and that are at risk for COVID. I mean, it just is this cycle. Yeah. So do you want to do that? Are you willing to trade off and kill, in the state, thousands of more people?
Doctor, weigh in on remdesivir. It seems like one day it's good, one day it's not going to work. Where do we stand? There is an update on remdesivir.
Okay, so remdesivir is the drug, antiviral drug, developed for Ebola, that all these drugs for RNA virus diseases like Ebola and SARS, they kind of have a common enzyme that these kind of drugs inhibit, and that's why it works. Now, in all the 3 studies that remdesivir was a placebo-controlled study, they had a shortened stay in the hospital, but there was never a survival benefit. Now, the WHO went and looked at thousands of patients in many countries, and they came to basically the same conclusion: no survival benefit. Now, in the United States, being in the hospital is very expensive. And people, the longer you're in the hospital, the sicker you are. And remdesivir does shorten that stay. But it's actually a very weak drug. It's not going to improve survival, but it will get you better faster.
Gotcha.
We need something much better than that.
All right, here's some viewer questions. This person says, my mom is in an assisted living community and it's just my husband and me at home. Is it safe to have mom home for Thanksgiving dinner?
Get tested the day before Thanksgiving and have your test results. And if you're negative, you come home. Just be a little bit careful while you're at home. Some social distancing, and enjoy your Thanksgiving.
There you go.
Next question. When a successful inoculation for COVID-19 is found, how will I know that a person is inoculated? What is the proposed plan for this?
Well, there's a couple plans floating around out there. One of them includes actually an app on your phone where it will document the exact test, the exact vaccine you had, the date you had it, and presumably if you had antibodies tested after that, and that people will have something like that, or it could be as simple as a card. When I used to travel, I haven't traveled anywhere since February 1st, everywhere I go in Africa, I have to carry the yellow health card that shows that I had the yellow fever vaccine. You don't get into any country without that. So it's going to be the same kind of thing, I think, as this vaccine rolls out, because that's a really very relevant question.
All right, last question. Here's a Friday question. When all this is over, what kind of vacation would you like to take? Oh, the viewers just want to know about you.
I'm going back to France.
All right, we'll come with you. We're ready to go.
Paris. I want to go back to my second home there.
There we go. Oh,
nice.
Look at Mr. Fancy. He's got a second home in
He's
Paris.
a doctor.
Ladies, write that down.
No. I worked in France. I kept my apartment. So
Well,
going back.
Send an email directly to our Facebook page, and we'll pass that along to Dr. Murphy. Thanks so much. If you have a question for the doctor, go to our Facebook page, post it there. We'll talk to him again on Monday.
Well, can't you see him in a beret?
Oh, eating baguettes.
Yeah.
Talking with the ladies.
Send us a postcard.
Yeah, I'll send you a postcard. I'll send it with a picture from my window.
All right.
All right.
Hey, Morgan.
Morgan.
Hey, guys. Good morning.